As first classification, which is based on concept of general to particular. Here the prime importance is given to generals, and then uh, homeopath, they give importance to particulars. In that, first they have given importance to mental general, then physical general, and then particular. In many of repertories we studied that philosophical background. Then the examples are Kent's repertory, Lippe's repertory, synthetic repertory of Dr. Barthel and Clunker, Kent's Repertorium Generale by Dr. Kunzli, Homeopathic Medical Repertory by Dr. Robin Murphy, Synthesis by Dr. Frederick Schroyens, then Homeopathy and Child Care by Shashikant Tiwari. So these are the examples of the repertories which are based on particular to general. Then the second sub-classification of repertories having philosophical background. The second sub-classification is repertories based on concept of particular to general, on philosophical concept of totality based on doctrine of analogy and concomitant. So this concept of repertories which are based or which are in which the importance is first given to particulars and then generals. These repertories are mainly based on some doctrines, in that doctrine of analogy, doctrine of concomitant. These doctrines are followed in these repertories. The example of these repertories is Therapeutic Pocket Book of Dr. Puning Hussain. Then these repertories are also based on complete symptom, doctrine of complete symptom, concomitant, pathological general, and the other some examples are Boger Boning Hussein's characteristics and repertory, synoptic key of materia medica. These both are uh, constructed by Dr. Boger. So this is the two sub-classification of repertories which is having some fixed philosophy. Then the other classification is repertories having no distinctive philosophy. These repertories are mostly used for the purpose of reference and not for systematic repertorization. So these are the repertories which is having no philosophical background, which is having no fixed philosophical background, and these repertories are, they are not used for systemic repertorization. They are used only for the purpose of reference. They help because mostly they are written in the language of repertory, proofers. They help used to refer to symptoms without much variation in the language of proofers. Means the symptoms, whatever written in this repertory, it is in the language of proofers, and so they, these symptoms, they are also called as the pure symptoms of the prover. They are not converted into the repertorial language, and so the language, pure language of the prover, it was seen in this repertory. So this repertory is also called as Puritan repertory. Uh, it is these repertories, these type of repertories, they are also called as concordance repertories. So the repertories which having no distinctive philosophy, these repertories are called as Puritan repertory as well as concordance repertory. And the examples are Nair's repertory of herring guiding symptom, and the concordance repertory of material Materia Medica by Gentry in 6 volumes. So these are the example of repertories having no distinct philosophy. And remember, these repertories we are not using for the purpose of repertorization, but only for a reference purpose we use these type of repertories. Then clinical repertories. The clinical repertories separately also we studied. The name itself suggests that in these repertories we found many clinical rubrics. These repertories have many clinical rubrics under different systems, and medicines are grouped against the name of disease. They are subdivided as follow, covering the whole. So these are the repertories which are having clinical rubrics. The clinical rubrics which are mentioned under different systems, and the medicines. Clinical rubrics means the diagnostic rubrics they have given in these type of repertories. And these repertories, some repertories out of these clinical repertories, they cover the whole person's clinical rubrics. Some repertories they cover the some region or some part of the body. Some repertories they cover the clinical condition. So in this way, the repertories are subclassified. These clinical repertories are again subclassified. So the first class or subdivision is covering the whole. So the example is clinical repertory appended to Borix Materia Medica and clinical repertory by J.H. Clark. So these are the examples of clinical repertories. That is, the repertories cover the whole, the Borix Materia Medica and Clark's General Clinical Repertory. These are the examples. Then the repertories covering the regions. They deal with the disease condition or a part. Means in these repertories, some these are also called as regional clinical repertories. In these, some repertories they are based on special parts of the human being. For example, Berry's eye repertory, Morgan's urinary organs. So these are the examples. Milton's uterus. So they are based on some special part. Then some repertories they are based on clinical condition. So the repertories based on clinical condition they are called as Robert's rheumatic medicine, then Bell's diarrhea, then Allen's repertory of intermittent fever. So these are the examples of clinical repertories which are based on some clinical condition. Then the next classification of repertory is card repertories. So card repertories, we studied the card repertory in detail. So these are the slips of cards arranged systematically, facilitate the work of finding out remedies. Mostly in it consists of punched cards. So the card repertories, there are different card repertories, and they are the punch cards which are arranged systematically so that it will be easy to find out the remedy. So the example of card repertories are Kishore's card repertory, Bogar's card repertory, then Field's card repertory, P. Shankaran's card repertory, Sharma's card repertory. So these are the examples, some examples of card repertory. Then mechanically aided repertory. So under that, the mechanically aided repertories, these are the some autovisual repertories. These are not the book, but these are the for the example of mechanically aided repertory are Patel's autovisual repertory. Uh, this is the example of mechanically aided repertory. Then the computer repertory. The computer repertory, these are also very much useful repertories nowadays, and these repertories we the most of the homeopath, most of the physician, they prefer these type of repertories because they are time saving and with less efforts, within less time we can easily reach towards the simillimum. So that most of the homeopath, they nowadays they are using these type of repertories. So in this way, this is in short about the classification of repertory. In detail, if you uh, if you uh, there is need